Okay, we'll go ahead and get started. Good afternoon, everybody. Hope you're all doing well. If you want to send me a quick thumbs up and let me know that you can see the PowerPoint presentation. So, Heather, did you have a question?
That was meant to be the thumbs up, but wrong icon. Thanks.
Okay. Got a couple more people. Okay. Welcome to the 2023 ABRC awardee cohort training. My name is Keelan McCool. I'm the Deputy Program Director for the Arizona Biomedical Research Center. We'll give you a little bit background about our program. We were established in 1984 and originally a commission, but then moved under the Department of Health Services in 2011. Our mission is to identify and support innovative biomedical research to improve the health of all Arizonans. Our funding is from two primary sources: the Disease Control Research Fund, which is monies received from the Arizona Lottery, and then the Health Research Fund, which is monies received from the tobacco tax. And so all of these research grants are funded by that Health Research Fund. A little bit about our staff. We've got an executive director and program director, Victor Waddell and John Garcia. They couldn't be here with us today, but we also have myself, deputy director, and then our grant administrator, Teresa Caro, our finance manager, Laura Serna, our grant project coordinator, Natasha Newsom, and then our senior procurement officer, Caitlin Burson. So the ABRC is primarily split into three programs. We've got the research grants, which is what we're talking about today, and then as well as our research education and our public cord blood program. We provide grant funding to put on different conferences at our universities, or and then we give funding to the public cord blood program, different hospitals around the state, to fund the consenter and collectors in those hospitals. Our website is part of the Department of Health Services website. It can be found at azdhs.gov/biomedical. That's where you'll find our annual report, the grant reviewer applications, any documents and things like that. Our 2024 RFGA solicitation will be released this summer, so stay tuned for some more information on that. You will be able to see it posted on our website. You can also sign up to be a grant reviewer for our LOIs and applications, full applications, under the grant reviewers tab. If you have any colleagues who would be interested in this, we definitely could use more to speed up that solicitation process. And this webinar in particular will also be made available under the documents tab. So if there's anything you've missed or you'd like to refer back to, we'll have it posted there this week. So our annual report is also found on that website. I'll go into a little more detail on the deliverables we need for that, but later in the fall, we'll ask for a profile photo as well as an up-to-date abstract so we can include it in the annual report. So we'll jump into this current solicitation. We received a little over 200 LOIs total, 53 NIAs and 150 IGs. So the IGs were a little more competitive this year. We ended up inviting all NIAs to apply, and then 73 of the IGs. 20 NIAs were awarded, as well as 7 IGs. Okay, so a little bit about the contracts. Your contract is between the state of Arizona and your institution. Your purchase order will be for the initial 3-year contract. And there you'll see the MPO and the GAE number from this document. Those will be used on the contractor expense report. So if you ever receive an updated MPO number, you'll put the most recent one on the CER. And then funding from year 1 to year 3 will roll over automatically, but you can expect change orders for those MPOs whenever we're moving funds into the next fiscal year. So you may receive one in the next couple months since we're entering fiscal year 25 in July. Any extension requests will be required to utilize funding beyond the initial length of contract. So if you're going into year 4 or possibly year 5, you will need to request that extension. If you move institutions, you will need the permission of your current institution to allow you to take the award with you, as well as the permission of the new institution to bring the award forward. Both an amendment and a new purchase order will be required to complete that process. And then if there are any changes or addition to the investigators, the PI must be based in Arizona and a copy of their CV will need to be provided for our files. Does anybody have any questions on this particular page? Moving along. We've got some reminders from our procurement. You will need a valid COI annually for the PO to stay valid. Insurance coverages and amounts must match the insurance requirements that are outlined in the contract. The Arizona Department of Health Services must be listed as the certificate holder. If the grantee is a public entity, the insurance requirements do not apply, and a certificate of self-insurance may be submitted. These requirements do not apply to any state of Arizona agency, board, commission, or university. And then a little bit about the budget periods for this cohort. We did have a couple that are on a little bit different periods, so you can see you'll probably fall into one of those 3 that are listed there, and they are for the full 3 years. When you're submitting the CERs, you must submit supporting documentation for the expenses. So no spreadsheet summarizing the expenses. We need an actual accounting ledger that's organized by the appropriate reporting categories. ADHS does reserve the right to audit the awardees. And if you want to move money between lines, you can send an email request to biomedical@azdhs.gov. Once approved, the amended budget can be completed on that column in the CER. No more than 10% can be spent on indirects, and then no more than 20% for equipment without prior approval. So we'll jump into the CERs. PIs and admins have been provided the templates for quarter 1 through quarter 4. Sometimes we do receive updated CER templates from our financial department. If that's the case, we'll send you an updated CER to use, but this is the most current one. Your template should be pre-filled using the initial budget from your offer and acceptance, and this can be amended if you do need. You'll be completing the columns for the prior reporting year-to-date, the current reporting year-to-date, and the total year-to-date expenditures, along with the certification in the bottom right corner. These RFGAs follow a cost reimbursement, so you can see the fixed price and matched expenditures, 7 and 8. Those you'll just ignore. And then a unique invoice number is required to process these CERs. So you'll see items 1 through 5 you'll be completing, and you can put in an invoice number of your choosing. So deliverables and expectations for admins. Please double check the CER items 1 through 5, as well as all calculated expenses. Incorrect CERs will be returned and possibly delayed payment. Supporting documentation should be attached separately. We'd like the CER in its own document. That's the only one that will be forwarded to finance for approval and then invoices for processing. They must be signed by an authorized individual and emailed to biomedical@azdhs.gov. This is the first step in processing CERs, so we'll be providing the approval and then sending them to invoices. They are due 30 days after each quarter, but there is flexibility if needed. And payments will not be processed until the corresponding quarterly progress report has been submitted and reviewed by the ABRC. And then for PIs, you should have received the quarterly progress reports quarter 1 through quarter 4. Q1 through Q3, those templates are interchangeable and have the exact same information being requested, but the end of year template has a little bit more, and just be mindful of completing that one. Answer the questions the way they're written. For example, if it asks what percentage of the entire project is complete, please provide an estimate of the percentage for that entire project. And then provide a narrative of your activity and do not state just on track or NA. Give us a little bit of details that we can see what's going on from quarter to quarter. And then, as I mentioned earlier, we'll have our annual report at the end of the year. So you must submit an updated abstract and photo every November. We'll go ahead and reach out to you for that so that we can make sure everybody is accounted for. The abstracts will be published online. And so if you want to use plain language, try to keep it small, short. It's going to be a lot of different research projects in that annual report. So updated abstract and photo will be used, annual report. And then you can also choose speakers for the research conference. So the research conference, all awardees are expected to attend unless there's some other circumstances. You can definitely let us know. There's a poster presentation, and then depending on how much progress is made, the ABRC will kind of evaluate the awards during that year and then ask a few of our PIs to present. And if PI can't make it, you can always assign a team member as well. So carryover and unspent funds, carryover will automatically be calculated by the ABRC each year, but it's important that you are also tracking that as well from project year 1 to project year 2, so that if we don't get a template out in time, you know exactly what you're starting with. If you have more than 50% of 1 year's funding unspent, you'll be asked for an updated work plan and a budget to explain how you plan to use the funds and complete your project in the time that's left. Extensions may be permitted on a case-by-case basis after the 3rd year. However, there will be no extensions beyond the 5th year. And then for any sort of publications, abstracts, presentations, please make sure to give credit to the Arizona Biomedical Research Center. We were originally the commission, but this was disbanded. So just be mindful of the language there. The ABRC no longer supports patent endeavors, so please contact your technology office for discovery, disclosure, and patent requests. You must show justification amounts, receipts when requesting reimbursement on the CER for equipment and for purchases over $5,000. Investigators organization holds the title to the equipment, so there's no worry there. And then IRBs submit approval to ABRC prior to start of project. And then for site visits, the ABRC will contact you to set up an informal site visit. This is typically done within year 2 or year 3 of the award, but this will be a one-on-one visit to discuss the current research, upcoming events, funding opportunities, tour the lab facilities, just kind of make sure that the funding that we're providing is going to what it's requested for. And then here's just a little more contact information. Our main phone number is 364-0157. You should be able to reach one of the members of the ABRC if you do contact that. There we go. Do we have any questions? Yes, Sam?
Hi, Galen. If I may, I have 2 quick questions.
Oh,
2
I can't
admin
quite hear you.
questions. Can you hear me? Can you hear me? Can you hear me now?
Would Would you be able to type your question in the chat?
I think I got it. Can you hear me now?
Weird. I guess I can't hear from. Let me. Can you try talking one more time? It might be just my speakers.
Yes.
There we
Hello?
go. Okay.
Oh, there we go. Perfect. If I may, I just wanted to ask two quick admin questions regarding the CERs. So my first question is, can we expect ABRC to continue the practice of providing and filling out the budget categories on CERs quarterly, or has this changed to annually as you just presented?
The main budget column will be completed at the beginning of the year, so that should be already laid out. If you need it amended in any way, there's a separate column there, and we can go ahead and add those amounts there and provide approval, and then you can keep that one within the CER moving forward. But we'll just be calculating the annual budget at the beginning of every project year.
Okay, at the beginning, because I know that previously sometimes you would, well, the common practice that we see over here at the University of Arizona was that we would receive the CERs and then the budget would be updated once that CER was sent quarterly. So the template was sent quarterly. So I just wanted to clarify that that way we know what to expect moving forward.
Yep, we're trying to get back on track and send those quarterly, but right now we're a little bit delayed and I'm trying to process some payments. And so we're providing all 4 quarters up front since that's the most recent CER, and you should be able to complete it with the amended or with the initial budget that we put in.
So that'll be the practice for now, and then sometime in the future we'll go back to the quarterly templates.
Yeah.
Okay, perfect. Thank you for that. And my second question is, so I saw on one of the slides that the CER and backup are to be submitted separately.
Yeah,
that
right now I do see a lot of them come in together, and then it's our practice just to kind of separate them before they're sent to finance. If you can keep those separate, it would just kind of speed up the process.
Okay. Okay, good to know. Thank you so much, Kaylin.
Yeah. And then it looks like we got another question. How do we submit for IRB approval to ABRC? And do we need to submit our institution IRB to ABRC? Do you know his procurement?
What is that?
I kept that portion in there from John's previous PowerPoint. I'd have to do a little more digging into the IRB approval, but I can get back to you on that one.
Yeah, I just wanted to clarify because your slide had said to submit IRB approval on it. So I was just wondering, like, does the ABRC need to have their own approval in addition to our institutional approval? I was just clarifying the slide.
Okay. I had to, I'll have to double check on that one. I'm sorry about that.
Okay, yeah, no problem.
Are there any other questions?
I have one question. Can you hear me?
Yep.
Yes. So I received the information about the grant last month, and I got an email requesting to do the first report by the end of July. Well, I didn't have time to do any experiments. How should I pursue that?
I guess the timing of it can be a little bit difficult because we can't initiate those purchase orders until the offer and acceptance is finalized. And so a lot of these projects, we see that the Q1 doesn't have any expenditures. If that's the case, you'll send it back with $0, 0 cents, and have it certified as well. And we'll just keep that for our files. It's why we also allow that year 4 and year 5 extension to kind of make up for that time at the beginning.
I see. Okay, thank you.
Any other questions? Awesome. Well, I'll go ahead and get this posted to our website under that
Sure.
documents tab. So if there's anything else you guys would like to refer back to, that'll be up there. You can also,
Someone have a question
oh, yep.
in the chat.
Oh. Let's see. Well, if you leave Arizona during the 3 years, the grant will still be with that institution in Arizona, and you may have to assign a co-PI or another member of your team. Yes, Navish?
Yeah, I have a quick question about personnel. So I wanted to know what kind of flexibility is there in hiring personnel. To be a little bit more specific, if I say in the budget that I will hire a PhD student, and if I have a hard time finding, the PhD student with the right qualifications, can I hire a postdoc or a research technician instead? And what would be the process to do that?
There's flexibility there. You'd still be able to hire whoever fits the criteria for your specific grant. You just give us a copy of their CV so that we have on file who's working on the program.
Do I need to get permission beforehand or get some kind of paperwork done before I do the hiring?
As long as you're still the main PI or co-PI and we're not adding any additional people, you can go ahead and do the hiring that you'd like.
Mm-hmm.
We
Okay.
won't keep track of the entire team.
Okay, thanks.
Yes, Grace?
Hi, I wanted to get clarification. When is the research conference that the PIs will need to attend?
Let me double check.
If you don't have a specific date, do you have like a month, a quarter?
It shouldn't be until 2025, the beginning of 2025. So I can find the exact date and then I can send it out to everybody who's on this call.
Cool. Appreciate it. Thank you.
Yeah, no problem. Any other questions? Yes, Sam?
Could you also include a link to this presentation if you could?
Yes, of course.
Thank you so much.
And Sui. Oh, yep, I just saw your question in the chat. Can we change the project start date? Unfortunately, we can't change the date that it was executed. So whatever kind of your budget period falls into, I'll scroll back to that. There we go. So those project periods under the budget will not change, but you can go ahead and kind of start your project when you'd like. That's why we don't see a lot of people doing the reimbursements in the Q1, as they end up choosing a different start date. But you'll still have to kind of fall in line with the CER reporting periods. So that first one for the April to March will be for the April 1st, 2024 to March 31st, 2027 project period. That first Q1 should be around April to June reporting period. So you'll still kind of fall within that, but you don't have to necessarily start your project until you're ready.
Okay, I think Kenny. So I think my question is that I received the email for project active. It's just recently, maybe like 1 or 2 weeks ago, but it says the start date is from April. So actually, I haven't received any like active email or for the project in April. So that's my question. So can we change the start dates a little bit later time so we can have time to prepare or report stuff?
Well, the project period can't be changed at all, so you'll still fall within those first 3 years. But if you need an extension beyond that for year 4, we can kind of accommodate because you weren't able to start your project until the date that you chose.
Oh, I think I don't need to extend that. My question is that because we didn't receive any email in April, so I'm wondering about the start date shows that it starts from April when I received the email. So I'm wondering if we can change the project start date in July or June or something like that.
We can't change anything on the executed contract for it, but you don't have to begin your project until July if you wanted to. So you could skip that Q1 reimbursement period and kind of start in Q2 and go from there. But
Oh, okay.
the contract would not be able to change its dates. So that stays with what the offer and acceptance date ended up being.
Okay, got it. Thank you.
Yep. Tina?
Sorry about that. Couldn't find my microphone.
You're good.
In that vein of what you had just said, so ASU, all the CER invoicing gets done from a centralized location. So there's sometimes delays in the CER reaching me for new awards. Is it possible if I were to send you a list of the awards that I have, that I work on, that I could be included in emails for those CERs and templates for the PI progress report?
Yeah, that would be great. We tried to send them out to whoever we had on file at the moment and to the PIs as well. So they have already been prepared and sent out. If you want to give me that list, we can definitely send it to you.
Okay. I think I may only be missing one at this point. Teresa had sent me one that was new that I was looking for. So I think I only have one, but I just wanted to make sure that the awards that I do have going forward, that there can be some sort of way just to make sure they're reaching me timely. So I'm not going, oh my gosh, I don't have a template. But then also what you were just saying to the prior gentleman about, that sometimes the award starts late, there are no expenses. I know that I've been sending 0 CERs in those cases where the expenditures are delayed in posting because the award is starting a little later. Do you want me to continue sending 0 CERs for the quarter, or do you not want those 0 CERs?
Yes, we do. So if there is a quarter where there's no expenses, go ahead and still send those. That way we have it in our files that quarter has been processed and we're looking for the next one.
Okay, perfect. Thank you.
Yeah. Any other questions? Okie dokie, well, I'll go ahead and wrap this up. You can email Biomedical or you can email myself directly at keelan.mccool@azdhs.gov and we can answer any questions that may come up after the fact. But that should be everything. So have a good afternoon and thank you so much for joining us.
Thank you.
Thank you.
Thank you.
Thank you.